In New York City, 2 new cases were confirmed today. A man in his 40s and a woman in her 80s. Both are in critical condition and in the hospital. Both have underlying health disorders. Mayor de Blasio spoke about the cases a short time ago. One of his main concerns is the community spread of the virus, since both people do not have a travel history to impacted countries or a connection to existing cases. Eyewitness News reporter NJ Burkett is live in Lower Manhattan with the latest on the New York cases. NJ.
And right, Liz, the mayor says that is an absolutely critical point. We are outside City Hall where the City Council is having an emergency coronavirus hearing at this hour. But the headline on the story, as you said, is that 2 new cases have been confirmed here in New York City, and both of the patients are New Yorkers. Now, that information came to us at a marathon press briefing that was held at One Police Plaza, New York City Police Headquarters, where Mayor de Blasio confirmed that the 2 patients are a man in his 40s, and as you said, a woman in her 80s. The man, he said, had a serious pre-existing medical condition. The woman obviously is elderly, both hospitalized and in critical condition at this hour. Yes, it is a major development in the course of the coronavirus in New York City, because this is the first known instance of what public health experts are calling community spread. These 2 patients are entirely unrelated and had no travel history to the hotspots overseas, leaving authorities here to conclude that they contracted the virus in this area. How? Impossible to know at this point. Did they infect other New Yorkers? Impossible to know that either. Health officials are now working to retrace their steps and to see who may have been exposed. Mayor de Blasio called it a game changer for New York City.
To be very clear, the last 24 hours have changed the dynamic. Now, with community spread being established, it will be a constant discussion of whether we need to start canceling events. We are not there yet today, just based on what we're seeing, the limits we're seeing, the numbers on the testing and the high rate of negatives. We're not there. It is a constant conversation, and this is the group right here that will be making that decision together.
And the mayor insisted that this is not an alarming development, it's a concerning development. It is certainly what they expected to see as the virus unfolds here in New York. The mayor responding to questions about whether they will order additional steps, things like banning large gatherings here in the city. The mayor, as you heard him say a moment ago, he says we are not anywhere near that, at least not yet. However, the city is imposing mandatory coronavirus testing on certain city employees, teachers, healthcare workers, and first responders if they are symptomatic or appear to be.